And as the COVID-19 spreads around the world, some regions are restricting travel, while an estimated 300 million children face school closures. China, the world's most populous nation, remains the hardest hit, with deaths surpassing 3,000. The global caseload is at almost 97,000, with a significant outbreak reported in South Korea, Italy and Iran, with 11 deaths and over 160 confirmed cases in the United States. Congress has passed an emergency funding of $8 billion to control the outbreak.
We were pleased to learn that just shortly ago, the House of Representatives passed a federal funding bill by a virtually unanimous margin. It will now move to the Senate. And the legislation implements the President's vision to ensure that not only do our federal agencies have the support and resources that they need, but also that our state and local partners have their support. And in my conversations with governors all the way through this afternoon, I know they're grateful for the bipartisan spirit that has characterized this funding bill, and we'll continue to work through that process.
Well, for the latest now, let's go live to New York and speak to our correspondent Sherwin Bryce-Pease, who joins us from there. Sherwin, so after some political mudslinging around the amount of funding required in the United States, parties appear to have come together. What will this funding be used for?
Yeah, Aldrin, it wouldn't be the United States if there wasn't a political fight around this issue, given that it's also an election year. But bipartisan legislation exiting the House of Representatives by a margin of 415 votes to 2. So very much bipartisan between Democrats and Republicans in that sense. And really to get into the specifics, initially the White House had requested some $2.5 billion. But Democrats balked at that number, saying it was grossly underestimating the extent to which this virus would impact the United States. Chuck Schumer, the lead Senate Democrat, legislated in terms of an $8 billion response. We now see both parties coming around that $500 million, and this is very important, Aldrin, over 10 years towards remote health programs, essentially where healthcare practitioners can diagnose and monitor a patient remotely. And one can understand, given the chain transmission that we are seeing from COVID-19, why creating that distance through technology becomes important. $2 billion to the Centers for Disease Control in terms of readiness to get public funding, in terms of readiness, preparedness, and in terms of the response to the virus, $3 billion to the National Institutes of Health. They are tasked with the research in terms of vaccines, treatments, and testing for coronavirus. There's a shortage of coronavirus testing kits, so clearly a great deal of funding required for that, but also, tempering expectations. We talk about money being pumped into vaccines, but experts tell us that vaccines will only come to market if human trials are successful within 12 to 18 months. So it's not a short-term measure. It's a sort of medium term. $300 million will be set aside also in the United States to ensure, Aldrin, that Americans who cannot afford a virus when it does come to market will be able to get access to that vaccine free of charge. So very important funding mechanisms here, and certainly best case scenarios for some countries to learn from.
Sure, and with 11 deaths all confined to 2 states, and I see that earlier on the President Donald Trump about 30 minutes ago tweeting that this is because what he calls quick action on closing our borders, and he also says that we are working very hard to keep these numbers as low as possible. What are you learning?
Yeah, that goes actually against World Health Organization prescripts in terms of travel. They don't want countries to shut their borders because they don't believe that that is actually an effective response to the spread. It has viruses have a way of getting in despite the closure of borders, and one can understand why that would be. Of course, the epicenter of the outbreak, Aldrin, is, of course, in Washington State on the West Coast. 10 deaths in Washington State. The epicenter very much a frail care home in Kirkland, Washington, where some 6 patients have died. And of course, the other death has been experienced in California, the most populous, the largest state in the United States. Let's listen to what the governors of both those states, they both declared states of emergency. Florida is the 3rd state in the United States to do so. But let's listen to what the governors of California and Washington had to say.
We are dealing with cases of community transmission in the state of Washington. And so even if you do not think you're at risk of the virus, the steps you take to prepare will help everyone around you. We hope people will seek accurate information and don't accept rumors and unsubstantiated reports about the spread of the virus. We think folks should begin to think about avoiding large events and assemblies. And we are not making a request formally right now for events to be canceled, but people should be prepared for that possibility and need to be thinking about it.
With 53 tested cases positive, this is no longer isolated in just one part of our state. This is broadly shared as a burden and responsibility up and down the state. And I want to thank local leaders, including those that today, I think wisely and appropriately advanced a similar proclamation in the city and county of Los Angeles.
So family and friends, Aldrin, of the 108 patients at that frail care, that old age nursing facility in Kirkland, have been barred from entering the premises. That center essentially under quarantine. We also understand that more than 30 schools in the Seattle district of Washington state have been closed. Children have been told to stay home. Some have taken measures for increased virtual learning. The internet obviously playing a very important role here. And also big companies like Amazon and Facebook that have big headquarters in the Seattle region are now urging their workers to stay home. So clearly one can begin to imagine what the economic impact of this virus is going to be.
And we see on your right-hand side a live update of the total confirmed cases, 96,720, and also the list of countries that have been impacted globally. What does this mean for the global implications?
Yeah, I mean, let me step out here, Aldrin, and you can really see where the epicenters of this virus are. Of course, the big outbreak in China, of course, and surrounding countries like Japan and South Korea. Another big center in Italy, and now, of course, spreading over into various European countries. You'll also understand that Italy is part of the European Union, which means you don't need to go through any border. So migration and movement between the various 27 or so countries of the EU, that is why you're seeing that spread quite vociferously in that region, and of course Iran in the Middle East. And what we are now learning from associations like the International Air Transport Association is that this could knock some $113 billion off passenger airline revenues. We also understand that various airlines, Lufthansa, Air Norwegian, they are cancelling long-haul flights within the European Union and certainly long-haul flights to the United States. Italy has closed schools and universities for at least 2 weeks. Just imagine the economic impact of that and on households and on families. The expense, the aftercare expense, if families are working and your kids are at home, that is now an additional expense to various households. But the interesting factor, and if you look at the graphic behind me, is this area over here, Aldrin. This low outbreak, one in South Africa, one in Nigeria, and one in Senegal, 3 cases in sub-Saharan Africa, really confounding scientists as to why this might be. You hear talk about climatic conditions, maybe South Africa's the demographic in that region is not conducive to the spread of this virus. We don't know, but we see similar numbers in South America. So the Southern Hemisphere really benefiting for some reason in terms of low numbers of spread in terms of corona in their territories.
Just a final question. The World Health Organization raising its risk assessment of the spread of the COVID-19 to very high, but still downplaying the fear factor. Why is that?
Well, they believe that science is the most important thing here, and they don't want countries to panic. They believe that science, correctly applied, can arrest the transmission chain of this virus. So they don't, closing borders and panicking and not traveling to different countries. They're not advising nations to close their borders. And I'll read you an interesting stat from Tedros Ghebreyesus, who is the Director General of the World Health Organization. He pointed to the fact that 119 countries, as yet, a majority of countries in the world have not detected any cases of the virus. And of the 47 countries that have, 47 of the 76 countries that have reported cases have cases of less than 10. So echoing what President Ramaphosa was saying, it's not time to panic, it's time to apply the science here. Aldrin?
Well, then we continue to hear that. Do not panic. Sherwin Bryce-Pease, thank you so much for your time. That was Sherwin Bryce-Pease joining us from New York.